My name is Lisa. I'm from Manchester in England. I volunteer for Antibiotic Research UK. I was born on esophageal atresia, which is where your esophagus isn't attached properly. I literally had to be taken from my mum and transferred to another hospital, else I wouldn't have lived. At the age of 22, the false piece of esophagus that I have put in place from when I was born, that stopped working. So I don't eat at all anymore. I will be peg fed for the rest of my life. For the past 6 years, my body grew a bacteria around and inside the peg tube site. It's an infection that antibiotics have not been able to get rid of. I get pneumonia quite often because the bacteria in the infection is becoming resistant to the antibiotics. I'm having to take 2 or 3 different courses or trying different antibiotics all the time to fight the pneumonia. Last year, I had at least 9 courses. That's 9 months out of 12 that I was on antibiotics. I'm always worried about getting the next chest infection and bout of pneumonia and how much antibiotics it will take to get rid of that. It affects me physically and it affects me mentally. I hear people all the time saying the doctor wouldn't give me antibiotics for something. It's viral. That's because there's a reason. I'm already living with bacterial infections that have become resistant to antibiotics, but it can happen to anybody, and this is what the general public need to realise. Take the doctor's advice and only take antibiotics when need be. It's something that's going to become a major problem if we don't address this now.
Safety flows through me. BD, advancing the world of health.